Introducing TheSignalCast, a new and revamped podcast by UHCL's The Signal that dives into current events and issues from the student perspective. Hello, Hawks. This is Michaela with The Signal, and on today's episode of TheSignalCast, we're joined by a special guest to talk on the subject of trans children and why an approach called gender-affirming care is actually the best approach for families with trans kids. My guest is Autumn Lawner. She is currently a student at UHCL. She's studying social work. She also volunteers with the Texas Transgender Non-Discrimination Scholars Organization, which is basically a nonprofit dedicated to helping implement gender inclusivity into institutional policies. So if I got that right, that's wonderful, really important work. So she's also done a few inclusion and diversity employee resource videos on trans issues for her a company that she works at. And she's also spoken at Transgender Day of Visibility events in Houston. So she's very involved and doing what she can to make the world a better place for trans folks, especially as she is herself openly trans, and which is fantastic because we need people like you front and center to help the rest of the world kind of understand your experiences and your perspectives. So welcome, welcome, welcome. Thank you so much for being on here today. I'm so excited to talk about this because I think this specific topic is going to be really good to dig deeper into, because I feel like a lot of people are out there, and either because they don't know how to relate or they don't know anyone who's trans, they are actually kind of on the fence about, they don't really know what to think about allowing children to transition or go through gender-affirming care, because unfortunately there's a lot of misinformation and all of that. So I'm really excited to hear your knowledge and perspective on this. As you know, the Texas Attorney General Ken Paxton and Governor Abbott have been, or are trying to kind of paint this narrative that gender-affirming care is actually child abuse, and are trying to make it so that parents and even pediatric professionals who help support these kids transition, they're trying to make it so they are investigated and charged. So I don't know, it's pretty serious. Like, this kind of rhetoric alone can be really damaging, which I definitely want to get to that here in a minute. But I kind of feel like these attacks not only derive from like a political agenda, but they're also kind of definitely rooted in just ignorance, basically, which stems from not understanding why people want to transition, and which really starts at gender dysphoria. So I feel like that's a good place to start this discussion of just kind of defining what gender dysphoria is, and when someone, a person or a child, how early they can actually start experiencing it in life. So how would you answer that question of what exactly is like gender dysphoria?
Yeah, so I think to get to the point where we can kind of hit on what gender dysphoria is, there's a few terms that it's important to kind of hit off first, right? So we have the terms like transgender, gender identity, gender expression, and a lot of people don't even have the basic knowledge of those types of terms. So I feel like whenever going towards that understanding of gender dysphoria, it's important to start with those basic terms, make sure we get that in a proper lens, right?
Right.
So transgender is just an umbrella term for people who identify as a gender that's different from the gender they were assigned at birth. So the person's gender identity or their experienced gender, their authentic gender that they feel is different from the gender identity they're expected to have based on their bodies. So that's one thing I feel like a lot of people don't entirely get. There's this idea that if someone's trans, it's automatically this full medical transition and there's all these steps they go through. It's not always true for everyone. So we have the gender identity, which is that point where it's somewhere either male or female is the typical binary. It can be like a non-binary identity, so just somewhere along a spectrum. Can be even multiple identities at once, or a fluid identity that changes over time, or even just not experiencing gender. So there's a lot of different points on there that people can really fall under. in terms of that gender identity spectrum, right?
Right.
Gender expression is sort of how somebody expresses their gender. And this can change, this can be different. So somebody can identify as male, but express themselves in a more feminine way. Someone can identify as non-binary, but express themselves in a more masculine way. It's really just how that person feels and how they feel most comfortable identifying and how they feel most comfortable expressing themselves. So gender dysphoria, going into that, is the psychological term for a feeling of discomfort, distress, or unease that's relating from a mismatch between a person's assigned gender and the gender that they experience.
Right.
So that's something a lot of people will start noticing that difference when they're pretty young. Whenever someone's young, they don't necessarily experience that dysphoria though. It's usually more whenever someone's like 4 or 5, they might engage in certain styles of play that are typically expected of another gender, or they might kind of be insistent that they're a different gender. That's not necessarily gender dysphoria. That typically starts to develop more as someone gets older, and there starts to be that sort of conceptualization where they're able to start feeling that discomfort, distress based off of societal expectations of how they're supposed to act and how their body's supposed to be and how they feel they should be, right? I think it's also important to note that not all trans people experience gender dysphoria. Typically, whenever someone's medically transitioning, especially if it's someone who's younger, at that point, they would need to experience gender dysphoria, just for that sort of that gender-affirming care, that therapeutic sort of care to be provided. At least whenever we're talking about any sort of medical care. As far as social types of transitioning, gender dysphoria is not at all a prerequisite for people to kind of go through and work on that.
It just
I think
depends
it
on the
just comes
person.
a lot, yeah.
It just depends on the person, the case, the environment, the situation. And I don't think that that's something a lot of people understand, is that how much of a spectrum it is, how really like nuanced it is.
Yeah, there's a lot. It seems like the second you say transgender, someone automatically assumes it's somebody who's medically transitioning, going through all this whole process, whereas that's not always the case, right? It's really, it depends on each individual person. For some people, it can be as simple as just being acknowledged as their authentic gender, kind of living socially as that gender. And some people do want to go through that whole medical transition. So it's really, there is so much nuance there, like you said.
I guess with like, when it comes to children, like even young children, the anxiety is, or actually I'd say the misconception is that young children are actually being given hormone therapy and gender confirmation surgery when they're like 5, 6 years old. And that's not at all what's happening, right? And I feel like the word hormones is something that gets thrown out a lot. Could you like kind of break down what the difference between a hormone blocker or puberty blocker is from like hormone therapy? There's a very big distinction between those two.
It most definitely is. So puberty blockers are typically given usually before puberty, typically, or at the onset of puberty. So typically it'll be for someone who's experiencing gender dysphoria and they're starting to still kind of figuring that identity out and determining where they want to go. So puberty blockers effectively provide that time for them to further explore their gender, further determine how exactly they identify. And that'll be done with the assistance of therapists, doctors, their family, and of course with them, right?
Right.
So really puberty blockers are just that point of buying time to allow that sort of conceptualization to live as that gender, to make sure that that's the right path.
Right.
Once they go, should they decide, hey, I identify with the gender as assigned at birth, they'll get off the puberty blockers, go through puberty, and it's nothing different, right? Just go through
Right.
puberty like normal.
It's just a delay.
Should they,
Right. It's just a
exactly.
delay.
It's just, yeah, it's just putting a pause on there. Should they decide that they do want to go ahead with hormone therapy, typically that'll start at the earliest about 16 or so.
Mhm.
They've released, there's been studies that say it's a good idea to possibly do it earlier, but right now it's still at 16 to 18 range, whenever they might start actually doing hormone therapy. And that would be the point where you start doing estrogen for females, testosterone for males. They kind of go through puberty at that point, right? And
Right.
even then, should they start that, it's a very slow process. They start them off at a low dose. If at any point they say, I don't feel right here, at that patient's behest, they stop, right? There's no, you've started this, you have to go through with anything.
Yes, I would say that gender affirming care is an absolutely go by, decide as you go type thing. Like you don't have to, once you start something, you don't have to follow through with it. You could stop at any time that you're wanting to. So I think that's really important for people to understand, because like I said, people are actually thinking young children are actually being given this hormone therapy, which is just not based on any kind of reality. So that's really important to like clear up for folks, I feel. And also, as far as like gender confirmation surgery, that's also even later on, like 18 to 21, for them to really decide if they want to do that, I heard that there's even a large percentage of trans individuals that don't even choose to do gender confirmation surgery. So
yeah, most definitely. And even then, if they do choose to do it, it's a very highly regulated point. It's anytime it's done before 18, it's typically 16 or older, and it's only in extreme circumstances where it goes before medical board and it has to be approved, and it's extremely rare for anything like that to happen. Typically, once they're over 18, there's an organization called WPATH that goes through, and they have certain standards of care that you have to meet, as far as being on hormones for a certain period of time, receiving letters from psychologists or licensed therapists saying that you meet certain criteria for the surgery and that it's medically necessary. And then you typically have to get like a physical from a doctor, and then go through and have the surgeon approve all of that. And it's a huge process. It's highly regulated. And that's all before even starting to work with the insurance company, if you're lucky enough to have insurance that covers that.
wow.
So this idea that people go in your doctor's office and say, hey, I want this, and they're like, cool, we got you. What do you do next week, right? That's not at all it.
Right.
It's months, if not years, of a process. Yeah.
Well, that's exactly that. It's a very, very, for people under 18, it's a very long and involved process. I'm guessing even people over 18, it's especially like insurance companies and stuff, or.
I was describing it for people over 18.
Oh, okay.
Even people under 18, it's all that and so much more. And even then, it's typically such a long process that by the time they get to that point, they're probably in the 18 anyway.
Wow.
Yeah.
See, yeah, very, very long process, and a lot of hoops to jump through for sure, which is not easy on any individual or family, but only, like you said, only in those extreme circumstances. I also kind of wanted to talk about and just really shed the light on that, like basically every major medical and psychiatric organization agrees and recommends that gender affirming care is the best approach for trans children. But unfortunately, this misinformation that's being, kind of peddled about is just taking us a huge step back. And as you were saying earlier in our emails, it's actually negatively impacting the well-being of trans individuals and their families.
Yeah. So a lot of that is that societal perception. It's how trans people are viewed. Typically with trans people, there's two types. There's ones who are out about it, and there are ones who aren't. Especially for youth, with the ones who aren't, typically that's considered being in the closet. And it's really that point where they're not coming out because they don't feel safe. And whenever you see this legislation that's attacking them, that's saying, if you
Right.
do this, you're going to face all these consequences, it really is pushing them further into that closet. It's preventing them from coming out, being their authentic selves. It's preventing them from receiving treatment that's been proven to reduce anxiety, reduce depression, and reduce suicidal tendencies, which
Yeah.
is an unfortunate thing to say, but it's very real in the trans community. Then you have the kids who are out about being trans and being out in school and effectively having their lives legislated to in a way that impacts them in a really bad sort of way, as far as saying you're only allowed to use this restroom, or for a lot of kids who are on blockers or have started hormones, being told you have to get off of those. You're not allowed to take that medication that's making you feel better anymore. And if you continue to do that, it's going to be your parents that are going to suffer for it. And I think that's really hitting on such an unfortunate point of this whole discussion. There have been studies that have shown that whenever trans youth attempt suicide, one of the leading reasons that they say they had done it is because they feel like they're a burden on their families.
It's not so much that they feel trans, it's that they don't feel supported and from their loved ones, right? They don't feel like they're in a supportive environment. So, I mean,
so even for the ones who do feel like they're in a supportive environment, there's that point where it feels like you're a burden. It feels like you're hurting other people. It feels like being yourself is such a pushback just from the way that culture views trans people. And it's really pushing kids, especially if they don't have an affirming family, if they don't have an affirming community, into really bad situations. And this type of legislation that's actively attacking them, and this sort of media focus on really divisive issues and kind of cultivating that misunderstanding and that distrust and a certain hatred based off of a misunderstanding. It's really sickening to consider how that's impacting these kids. It's such a horrible thing to be afraid to go out in your community, to be afraid to go out with your friends, even just to be afraid to go to the doctor, right?
Yeah. Or to even like express yourself, like even more stringent schools, they won't let the boys wear nail polish or wear certain clothes, even types of colors of clothes. It's just too much control from the legislative side into people's private lives, for sure. And I never actually thought about it that way before. When you're saying these kids, they may be in a supportive environment, but yet they know from all this anti-trans legislation, they feel like a burden on their parents because their parents could get in trouble for supporting them. So that's a huge unfathomable type of burden to put on a child. That's so much responsibility, too much responsibility to put on a child. They should not be feeling like they're responsible for getting their parents, investigated and charged criminally with child abuse, which obviously it should be obvious that gender affirming care is the opposite of child abuse. Actually not treating them or not giving them the space that they need to figure out who they want to be as people is more abusive than actually giving them that care and attention that they're needing. It's just hard. It's really hard for people who can't relate and who don't know anyone who's trans to really understand what it's like. And that's why they're just so ready to eat up, what's the indoctrination of just falsehoods, basically, about the trans community. And it's like there's even a really horrible, narrative that's being spun now that the LGBT community is actually grooming kids to like take on our agenda or something like that. It's really disgusting. Like, no, you know?
Yeah, I think one thing that's really missed is how much it's giving autonomy to them to find themselves, to discover themselves. It's not pointing them in a certain direction. It's not trying to guide them into being a certain way. It's saying, be who you are. We'll support you and help you find your way
Right.
to the path that's right for you.
Yeah, exactly. Giving them that space and giving them that time to actually take long and careful assessments of themselves and discuss, like, as the child gets older, who do you want to be? And, you know, who do you feel most, where do you feel most comfortable as, you know, in this world, basically, so you can, you know, go on and be comfortable in your skin and live a healthy, productive life. So yeah, it's really, really important. Really important to understand and actually try to have some empathy as far as what these families and these kids are going through, because I think that the trial was actually delayed again for Governor Abbott's directive.
So I know there was a case Lambda Legal had, it was, I don't remember where it was of course somewhere in Texas, but basically there's a group of parents who are with PFLAG, and effectively they said, hey, you have to stop investigations if the parents are part of PFLAG. So it's kind of where they're at right now. I think the unfortunate reality of it is it's going to keep bouncing back and forth like this until the next legislative session starts. And then,
yeah, that bouncing back and forth is definitely, I feel definitely like we're very, it's like almost like Pride Month is just bringing out the worst and, you know, and all of it, and bringing out the politics of it all, and which is really, really unfortunate with like Florida's Don't Say Gay bill and with a lot of anti-sports trans bills. It's this onslaught of attacks. And I really want this to go out to people who are kind of in the middle, who don't really know enough about it, because there's not really any readily accessible like content out there that's actually accurate and informative. So that's why I really kind of wanted to do this podcast on this topic, because I feel like it's just something that people want to advocate for, but they don't know enough about it, and really understand the nuance of it, because it is nuanced. It's very involved. It has a lot of, you know, complexities. So yeah,
which I think one thing that a lot of people really miss is supporting people in your community. If you know a kid who might be, say, hey, these are my pronouns, use those pronouns. If they say, hey, this is my name, use that name. It's helping them discover themselves. It's helping them kind of find that identity. They might do that one day and the next day they're back to their old name, but it's helping them figure out who they are and discover their way for themselves.
right.
I see so much pushback from that in particular. It's just somebody says, hey, I want to try this. And then there's just that huge pushback. There's that huge attack. There's that constant misgendering and dead naming. And that really creates a conflict in that kid, because they aren't able to find that experience for themselves and see if it's right, because they're not allowed to experience that. So for people who are kind of wondering, hey, how do I be more supportive? Listen to people and respect them for who they are.
Yeah, it's that simple. It's just all about being a decent human being, really. But I know that we are, especially in today's society, media just pulls us all in different directions and stuff like that when we don't know what to think. So, but yes, it all comes down to just being decent to somebody, you know, to a kid or a person who's like, no, this is who I am. Please use this pronoun. It shouldn't be that hard to accommodate, especially if you know them well, or they just came out to you. Definitely make them feel more supported and loved and cared for in that way. It's I think it definitely does more. It's definitely those small things, like just calling somebody by their correct name or their pronouns, their correct pronouns. I think that does so much more good for that individual than they realize. They definitely feel, because everybody just wants to feel belonged. Everybody just wants to live their lives and be comfortable in their skin, just like everybody else gets to. So that goes a long way. Those little things go definitely a long way, I feel. Well, Autumn, thank you so much for being on here today. I think that what we just talked about here today has been really helpful in understanding that, gender affirming care is the most reasonable and even ethical approach for trans people, including children. So so they can just go on and have the best chance at living healthy lives and lives that are full and productive, and they don't have to be like constantly plagued with shame and depression. So yeah, thank you so much.
Thank you.
All right, Hawks, thanks so much for joining us on this episode of the TheSignalCast. If you'd like to learn more about trans youth and gender affirming care, links to some really great resources are going to be in the description. And don't forget to check out this issue of The Signal so you can learn more about what's happening on campus and how our students are tackling important issues like this. Don't forget to follow us on all of our socials. Until we cast again, stay well.